separating two human beings at birth, removing your entire esophagus, living with a hole in your skull. Here are 7 of the most dangerous medical procedures that could either heal you or kill you. While there are many different types of medical operations, and they all have risks, there are some medical procedures that prove to be extremely risky. Today, we're not holding back and discussing the most dangerous types of procedures to experience as a patient. But before we get into it, if you're new to my channel, welcome. My name is Dr. Jordan Wagner. If you enjoy the educational reaction videos and other stuff that you see here on this channel, please smash that subscribe button and turn your bell notifications on. That way you learn when I post a new video. All right, let's dive right in. Number 7 on the list of the most dangerous medical procedures, the separation of conjoined twins. A grueling 9 to 10 hour procedure that could involve at minimum more than 30 different surgeons and specialists like anesthesiologists, hepatologists, surgeons, nurses, technicians, all simultaneously working on this crazy operation. You might be wondering what exactly is a conjoined twin. Conjoined twins are identical twins who are joined together in utero. This is an extremely rare phenomenon that occurs only once every 50 to 60,000 births. The two twins could be connected at the skull, the chest, share organs, not share internal organs. To say it gets super complicated when discussing a separation surgery would be the understatement of the year. Talk about high risk? I mean, if the twins are conjoined in an area that can't be divided evenly, the surgery could result in death of one or even both twins. And the decision of whether or not to even have the separation surgery is a very serious discussion to have as well. Generally speaking, medical experts out there report that conjoined twins typically have a poor prognosis, with only 60% of surgically separated cases surviving. So it's a true medical miracle when these types of surgeries are successful. Number 6 most dangerous medical procedure, colectomy. From 2008 to 2011, some scary stats revealed that the mortality rate for this type of surgery was somewhere around 5.3%. The complication rate was over 42%. That's a very high possibility of things going wrong. So let's dive deeper. What exactly is a colectomy? A colectomy is a very involved medical surgery that removes all or part of the colon, also known as the large intestine, the long, nearly 6-foot tube-like organ that makes up our digestive tract and handles things like dehydrating your food and turning it into stool, and getting rid of that waste from our body. But here's the craziest part. One of the more common reasons one may have to undergo emergent surgery and have part of their colon removed is an infection that can occur in the small pocket of the intestine. This pocket infection condition is called diverticulitis. In a perfect world, this can be treated with antibiotics. But if the infected pouch decides to rupture, unfortunately, surgery is required to remove that part of the colon. That, however, is not the only reason one may undergo a colectomy. Things like volvulus or twisting of the intestine may do it, bowel obstruction may be a culprit, Crohn's disease, ulcerative colitis, and colon cancer. Well, they are always a very delicate and serious procedure with a high chance of infection, bleeding, blood clots in the legs or DVTs, pulmonary embolism or blood clots to the lungs, and damage to other nearby organs like the bladder and small intestines. And in addition to the removal of the large intestine, often patients will require additional surgeries to reattach the areas of the digestive system in order to let waste get out of the body, making this seriously one of the most burdensome surgeries to recover from and difficult procedures for physicians. Number 5, bladder cystectomy. Our next dangerous procedure could potentially greatly impact how someone uses the restroom and has sex for the rest of their life. And put simply, it's a dangerous but sometimes necessary surgery that removes the bladder. And in radical instances of cystectomy, the surgeon will also remove organs like the prostate, seminal vessels, uterus, and ovaries as well. Not always, but usually caused by things we hate, like cancer of the bladder. So what other complicated matters go into a procedure like this? Details like having to find new ways to properly store or get rid of urine inside one's body. A very important function of keeping the body healthy that one cannot overlook. To address this, sometimes surgeons will have to do a urostomy or a surgery that allows urine, pee, to leave our body without going through your bladder. Basically rerouting things a bit. Or specialists will sometimes do things like create or form an internal pouch from part of your intestines. They call these pouches NEOBLADDERS, and they're able to store a patient's urine instead of the original bladder that needed to be removed. Number 4, esophagectomy. If you were asked what your favorite body part would be, chances are you probably never in a million years named the esophagus. But maybe this often overlooked organ should be a bit higher on the pecking order. I mean, for starters, it does cool things like transport food and beverages from your throat to your stomach, helping keep you alive. But frankly, most people don't even think about their esophagus until something goes wrong with it, as is the case with our next dangerous procedure, an esophagectomy. Basically, this procedure is when they partially or entirely remove the esophagus tube. Typically due to cancer, it's the hope of medical professionals that if they remove an esophagus that is showing signs of having cancer, they're able to help stop the spread of cancer to your stomach and other organs. But because of the nature of the risky incisions to the neck area, things like impacting breathing, bleeding, leaking of fluids into the stomach, clots, and infection are the most significant risks. The size of the incision is also dependent on the severity of the process and how much of the esophagus needs to be removed. Number 3, another dangerous procedure, a craniectomy. The brain is clearly one of our most crucial complex organs in our bodies. That goes without saying really, but in case you need a reminder, the brain controls thought, memory, emotion, touch, motor skills, vision, breathing, temperature, hunger, and every process that regulates our body. Together, the brain and spinal cord that extends from it make up the central nervous system. So when you start talking about words like craniectomy, we know that things are about to get complicated. Basically, a craniectomy is a neurosurgical procedure that involves removing a portion of the skull in order to relieve pressure on the underlying brain, usually used in conjunction with treating TBIs or traumatic brain injuries, but that's not the only brutal part of the conversation either. As I mentioned before, during the surgery, part of the skull is removed to allow for swelling, but that piece of skull, well, it's not replaced immediately after the surgery is completed either. To put it simply, patients will have to recover from surgery and live with part of their skull missing, therefore leaving the fully recovered patient the risk of brain damage after the surgery if they do not adequately protect their head in that section. Also, if things weren't already complicated enough, depending on the area of the brain where the procedure is performed, other serious risks like changes or loss in functions of vision, mobility, speech, memory, coordination, and more can be permanent as well. In the past, this type of surgery was usually performed as a last resort, but with the progress of technology, it is utilized much more frequently nowadays and could definitely save a person's life. Number 2, spinal osteomyelitis surgery. Cue the dramatic music, please. This next procedure is a doozy, and if it's not fixed, can cause osteonecrosis or bone death. Yeah, not fun at all. Vertebral osteomyelitis is an infection to your spinal area, and it's caused by things like spinal trauma, bacteria, and viruses that spread to a vertebrae from the blood or even disc-based infections. Basically, any part of your vertebrae could potentially become infected, and severely infected at that. If a serious bone infection is left untreated, it could be life-threatening for sure and cause permanent physical impairments. Osteonecrosis, bone death, is no joke. Hence why a medical expert would suggest the surgery. But anytime we're talking about the delicate intricacies that is the spinal column and central nervous system, we have to pause and really point out the potential risks associated with having surgery on this highly sensitive area. Things like complete or partial paralysis or other serious infections beyond your already serious spinal infection. Number 1, thoracic aortic dissection repair. If you have uncontrolled high blood pressure or hardening of the arteries, you may want to listen to our next most dangerous medical procedure, thoracic aortic dissection repair. A whole lot of words that basically mean the risky emergency surgery to fix an aortic dissection or really serious tear in the inner layer of the body's main artery. You see, unlike Girl Interrupted's failed anatomy lesson of where the aorta is the largest blood vessel in the body. Basically, it's responsible for transporting oxygen-rich blood from your heart to the rest of your body. And not to rain on this medical parade further, but acute aortic dissection is unfortunately highly lethal if not recognized and treated aggressively. Anything that raises blood pressure significantly could also increase your risk. Alright, enough scary talk. Let's talk about fixing the aortic tear. How does one go about it? Well, a surgeon first will remove the dissected aorta and then rebuild the blood vessel with a synthetic graft. A very meticulous procedure that, should complications arise, you're looking at internal bleeding, stroke, organ damage, but if it's a successful procedure, you will get to go on living your best life. Alright, that's been some dangerous medical procedures with me, Dr. Wagner. Discussing these procedures is not meant to scare you, but rather educate you and open your eyes to how truly delicate our bodies are and how far the advances in medicine have come over the years. I find it truly remarkable that doctors and health specialists are able to do these procedures and save lives every day. Let me know in the comments if you know of any other dangerous medical procedures you'd like me to cover. There are tons. Maybe I'll include them in the next video. Please make sure you subscribe and turn those bell notifications on. When you do that and you hit that like button, you let YouTube know that you'd like to see more videos like this one. And if you enjoyed watching this, you should definitely check out this playlist right here. Thank you so much for watching and stay healthy, my friends.